We don't want to be going around depressing people or making people feel, that we're doomed, because we're not. But we're definitely going in the wrong direction. And we need to re-chart towards sustainability, and that's what we're doing.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we're speaking about climate change and sustainability in the HSE. As our listeners will appreciate, our work in health and wellbeing is all about prevention and working to reduce the cost of healthcare as part of the development of a sustainable health service. And today our guests are both working and leading on this work with a broad range of allies from across the organisation. I'd like to welcome our own HSE National Director, Dr. Philip Crowley, who is Director of Wellbeing, Equality, Climate and Global Health. And we also have Roisin Breen, who works as the lead for the HSE Climate Action Programme. Hello guys, you're very welcome to the podcast.
Thank you very much, Fergal.
Thank you.
So we're talking about climate action and sustainability in the HSE. Why is the HSE taking a concerted piece of work around this? I know you have a plan you're going to tell us about, but why is this such a priority for the HSE?
First of all, we all know that the planet is in trouble. We know we lost services in Middleton due to flooding. We know that Europe heated to an extreme degree last year, that new vectors, new mosquitoes and diseases are coming in through the southern Europe, diseases that were only ever seen previously in tropical areas. So we know that the planet is in trouble. So why would the health service care about that? I think there are two reasons. One is the health service is very much impacted by the impacts of climate change. First of all, the impacts of climate change on our actual services, like what happened in Middleton. But equally, climate change is impacting in a big way on disease profiles. And like if we're talking about health and well-being, we're trying to prevent disease. Creating a sustainable approach to healthcare will be part of reducing the burden that climate creates on population disease. Things like air pollution causing massive rates of heart disease and respiratory disease, heat events affecting older people particularly, multiple effects on our healthcare, and this ultimately impacting on demand on our health services.
So it's going to impact on us as a population and from a population health point of view, and then it's going to impact on our environment.
Massively. And the other reason, I suppose, that it's a bi-directional relationship we have with climate change. One is, that we will deal with the consequences of it. But, really most importantly in relation to the climate strategy, it is that we're major contributors to Ireland's contribution to global greenhouse gas emissions. We reckon the health service is somewhere between 5 and 8% of Ireland's emissions of greenhouse gases. That being the case, that gives us, I think, a major responsibility to show some leadership in Irish society to get our own act together, to reduce our emissions, to reduce our waste, and to become a responsible provider of healthcare in a sustainable way.
And Roisin, you've been working on this area for a few years now. How do you see the HSE looking at it?
Maybe just from an Irish perspective in terms of climate change, it would be important to say that we know that the annual average temperature is actually 1 degree higher in recent years. 60 of the 20 warmest years occurred since 1990 in the last number of years. Each year, an estimated 1,410 people die in Ireland due to air pollution. And I think we have a responsibility as well to act on this because our general public want it.
Yeah. So
there's been engagement in climate change research done by the EPA recently, where 89% of the general public said that climate change is important to them. 78% that said that they often talk about it around the dinner table in the evenings. And 71% want more about climate change, want to learn more about it, want the media to talk more about it. So therefore, as the biggest public sector body, I think it's really important that we show form.
Some of our listeners may not be aware of the size and scope of the HSE. When you look at organisationally, we're the biggest public service group or group of groups. We're like we're like an organisation of organisations, really.
That brings me back to the concept that gives us a responsibility to show some leadership. I mean, we have an estate of about 4,500 buildings, some of which are quite old, and that's why that increases our carbon footprint, because they leak heat, they leak energy. We have a workforce of 150,000 people, interestingly 60% of whom say they want to act on climate change. So we have the building blocks of a movement on climate change. But you come back to the kind of the challenge. I mean, the Lancet has been doing reviews of healthcare's challenges, and they've been looking at sustainability. And there's a consensus now that climate change is the biggest global health threat of the 21st century, dwarfing everything else. We have to wake up to that.
Yeah. The
Guardian did a review of climate scientists globally, and 70% believe we will go to plus 2.5 degrees centigrade instead of the limit that was set in Paris of 1.5 degrees. And many more of them think, somewhere in the region of 50% of them believe we're actually going to go to 3 degrees plus centigrade. That would put Rio, Shanghai, Amsterdam below seawater. This is serious stuff. And that's what the experts are telling us. So we have to listen.
And my understanding is the government have a plan around sustainability and climate change, and the HSE has been directed to develop this plan. Let's get into the plan. The name of your own plan is the HSE Climate Action Strategy.
Yeah.
And that sets out your commitments and plans. So let's talk a bit about that, because I think that was very interesting for me to see how you have highlighted a couple of key areas, some of what you've mentioned, but let's talk a bit more about it.
I think what's important about the fact that we developed a climate action strategy is that we developed it in the first place. Most countries don't have a climate action strategy for their health services. Some do, and we've been in close collaboration and communication with them. It's interesting, when we launched it, and we'll go into the details of it in a minute, we launched it in social media, and people asked that question, why are you developing a climate action strategy? And they were quite critical of the fact that we were developing a climate action strategy. Some people were people who, frankly, I don't know if they understood at all why we had this responsibility. We know we have to become responsible and sustainable in our healthcare system. And so that means that we've developed a very broad climate action strategy. We could have developed a strategy that really focused on our buildings and energy and greenhouse gas emissions from our buildings. And there was excellent work already underway in our estates division, making progress in that space. But we decided to develop a strategy that's way broader than that. And maybe Roisin will talk us through the details of it.
No problem. The broad vision of the strategy is making a commitment to achieve net zero emissions no later than 2050, delivering a healthcare which is environmentally and socially sustainable. So we highlighted within that 6 priority areas of focus.
That's a big thing. I know you're saying that quickly.
Not easy.
When I read that, I thought, wow, that is a serious commitment. You're committing to reduce emissions by 51% by 2030 and climate neutrality by 2050.
Yeah.
So, I know that's a challenge that all public services have to sign up to, but it's no small...
It's no mean feat, no. And I suppose, as part, as Philip mentioned earlier, we have the Government Climate Action Plan. Within that, there are 32 requirements, which we will have to, comply with.
Yeah.
And if we meet those, we will be on the road to that. But within that, there's lots of work that has to happen across those 32 requirements. But also, in addition to that, we have put a health slant on it with our strategy. So aside from buildings, we have a real focus on our greener models of care. So that's how we actually provide care. Our big focus there would be prevention. Prevention is the most sustainable healthcare at all that we can provide. So keeping people out of our services, self-management programs, health promotion, etc. That's a real key. Other big areas are water, waste, how we procure.
I don't think that might be understood or appreciated, and more than the scope. Like Philip, you gave a couple of stats there about how many buildings we have, how many staff we have. But when we procure services, we're buying stuff. I'm based in an admin part of Tullamore Hospital site, and I see these trolleys of equipment coming in that has to be disseminated across all the wards in the hospital. When I go across to the hospital for lunch, I think of all the produce that's coming in and all the different companies that are feeding everything from a syringe to every product that comes into the hospital. It's just huge. It's enormous. The scale of it is enormous.
Yeah, 70% of our contribution to climate harm comes through the supply, what people supply to us.
Yeah.
So we have to get into serious conversations with our suppliers to make sure that we prioritize suppliers who are themselves doing what we're doing, which is driving their own processes down to zero impact on the planet by 2050.
So that's a huge network, isn't it?
Massive.
Yeah.
We're not just doing that on our own. We're collaborating with partners in the UK, partners in the US and Norway and other countries, because we're small buyers, if you look at the global healthcare market. So if we can work with other people who are buying the same services, the same products, we'll create greater pressure on the providers. And it's not just providing pressure on the providers, it's also working with them to understand that this is the only way to go and make sure that they're on board, and really not doing business with people who don't come on board, and weighting our procurement decisions heavily towards sustainable products and sustainable providers.
Right. Sorry, Roisin, you were telling us a bit more about that.
Yeah, within those 6 priority areas of focus, how we intend on achieving net zero is through developing roadmaps across all of those areas.
Okay.
So this is where we are, this is where we need to get to, and how exactly are we going to get there? So developing a plan for services which they can implement at local level in terms of initiatives, things that we know have worked really well. We want to scale them up.
That's so important. Roisin, can I ask you again about the 6 priority areas of focus here? Now, I know we've gone into 1 or 2 of them. Can you just bring me through the 6 of them, just to clarify these? Because these are 6 big buckets of opportunity for us.
Absolutely, no problem. So, within the strategy, we identified 6 priority focus areas. Firstly, buildings. So that's all of our infrastructure and our green environments, all of the green surrounding all of our buildings. Secondly is transport and mobility. Transport, which alludes to our fleet. And the electrification of our fleet and mobility alludes to how people come to our services via public transport, cars, foot, etc. Procurement, that's just how we buy in our services. So massive opportunity there. Greener models of healthcare. So that's nearly a bucket for everything, because that's how are we going to green all of the care that we provide. So across all our different specialties, there will be different areas of opportunity that we need to tap into. Fifthly, there's waste and water. And then lastly is adaptation and resilience. So that piece is really about adapting to the fact that we will have more severe weather events, more flooding, higher temperatures, etc. So making our infrastructure and our buildings more resilient and equipping people with more information as to how they might deal with those types of scenarios.
When you think about those, what we see every season now is some variety of flooding event, and you're talking about a resilient workforce and a resilient health service. And invariably, the HSE is going to be sitting on the interagency group that's responding. I've seen it down Athlone, really shocking areas of flooding, and it becomes a huge public concern, and you're watching it on the news, and it is concerning that those kind of things happen more and more. Has huge personal impact on people, but the health service is picking up the problems.
It's massive impact on people personally, a massive impact on people's maybe local business, which can be very hard to recover from. And then, of course, as I've said earlier, it impacts our own services, because if they're in the flood area, they're not exempted. We've had experience of that already, and we have to then try and recover those services. That's a job of work.
Yeah, and respond to the health needs as a consequence of the event. So it's
very much so.
Multidimensional impact on the HSE over and over again here. My sense is, the climate conversation has gone from a place of anxiety to, what can I do? To, more and more public and civil servant and people that work in the community naming things that they can do. You need to name the tangible. And what you just mentioned there, having a roadmap, does give a level of practicality.
And I suppose as well, having a structure within the HSE in order to implement it. So a key to this would be our green committees. So we've, over the last number of years, there's been a real build on regional and local green committees. So that's just bringing people on the ground who are interested together to work on sustainability. But it's becoming more formalised now. So in each of the 6 HSE regions, we're hoping to have regional networks where people can come and share and learn and potentially scale up good ideas that have worked really well locally across all the other regions. And we hope as well to have at regional level a regional green committee that will channel both up centrally and down to all of the services, what's working, how we're doing, how we're measuring, where we need to concert our efforts. So I think that's going to be really important. And another thing to mention, I think as well, in the health sphere, we have partnered with the Climate and Health Alliance, which is a NGO, which is lots of different members, both public, private.
An Irish?
Yeah, exactly. Yeah, an Irish group. They have professional bodies, educational groups, providers. So we have over 25 signatories on a charter, which basically mimics the HSE's climate action strategy. So in terms of getting a commitment across all of those 25 providers, not just the HSE, but all other healthcare providers, that we're all in the same boat. We all are committed to achieving this and we all want to work together. And as part of that, we're having our first national conference in November, which will be great to bring people together again to share and learn initiatives and make plan as to how we're going to tackle this going forward.
Yeah. Philip?
Yeah, and just adding to that, there are a couple of things peculiar to healthcare in terms of our contribution to climate harm. One would be anaesthetic gases. People, when we have an anaesthetic, I had one recently, the gases that are pumped into us go into the air afterwards. Also, they leak from pipes. We've analysed that. And these anaesthetic gases are way, way more warming than carbon dioxide. We have a programme of work to reduce our dependence on anaesthetic gases and to provide anaesthesia in a much more sustainable way. Things like inhalers, simple things like inhalers for asthma. The multi-dose inhalers that most people use release emissions to the atmosphere that are extremely harmful. And we're trying to move to more sustainable inhalers as well. And then things like, so many people use our services. So many people. If you think about the amount of transport that happens in a given day in Ireland, how much of it is healthcare related? A significant percentage of it. People going to their GP, people going to the community services, people going to see somebody in the hospital, people being admitted to hospital. So we're trying to green the whole transport to our services as well, insofar as we can influence that. And then finally, I think with our attempts to ensure that we don't harm people from intrahospital infection and that, we have really gone all the way towards single-use products in everything that we do. particularly in theatre. And if you look at, we use some videos sometimes just to raise awareness, and it shows people laying out in circles the amount of aprons that are used, the amount of syringes that are used, the amount, everything single use, everything probably put in a hazardous bag, put on a boat somewhere else and incinerated somewhere else. Think of the carbon footprint of that. Yeah. So healthcare has a couple of particular aspects and characteristics that contributes additionally to climate harm that we are tackling one by one and across our programs that are within our climate strategy.
It's certainly unique. And some of the examples that you gave there, you're auditing the risk and the challenges and trying to pick up projects that are going to make an impact here. Isn't that what's going on really?
Yeah, we've learned a lot about it. We've learned a lot from colleagues out in the system. We've learned from colleagues in other jurisdictions. We've trained ourselves up. But what's been really heartening, I suppose, this is always, isn't it, that, we don't want to be going around depressing people or making people feel, that we're doomed, because we're not. But we're definitely going in the wrong direction. And we need to re-chart towards sustainability. And that's what we're doing.
Yeah, and just yesterday I sat in on the HSE Excellence Awards, and we have a new category on sustainability, and it was just really heartening to see the amount of projects and the amount of enthusiasm and collaborative working around this. There was 40 applicants into the category, wide diverse projects from planting and greening the local environment.
Just to clarify for the listeners, the Excellence Awards are an internal Excellence Awards that you're obviously part of adjudicating on the submissions.
Exactly, yeah. And it was just so great. You could see how proud staff were on what they'd achieved. And I think it's a real topic that brings people together from multidisciplines, that everybody can be involved. And what was really interesting yesterday was that service users were actually coming in with staff presenting on different projects, which was great. And we're so proud of what they'd achieved. So I think it's something that really brings the general public and local communities in and to support. So I think there's a real capacity, because we've such coverage around the country, to work with communities on this.
So you think we're coming at it at the right time and want to take advantage of the growing awareness in the public and with our own staff?
Yeah, absolutely. And I think a lot of people say, we're all incredibly busy. We don't have time for this. Our people won't have time for this. And then people also say, people are getting burnt out. They're working too hard. Demand exceeds supply a lot of the time. That's why we're developing new ways of delivering care to ensure that we can meet the demand. But morale is really crucial. And I firmly believe that if we can support people to act on something that is important to them, as climate change is, because we know from our survey that it is, that actually, while it will require some work for people to participate in the green teams, to initiate an initiative to segregate waste better, to stop food waste and decontaminate materials rather than throwing them away the whole time. It may be extra work, but I really do believe it could be like a contributor to people feeling good about the work that they do in the health services, which often they do anyway, but I think it'll contribute to that, and I think it'll contribute in a positive way.
Well said. I'd like to get into some of the examples of the work, because I know you gave us a couple of examples of some of the things that have been done. Whistle stop there, Philip. But like I was saying earlier, the practical hits home, so I'm sure from the Excellence Awards or from some of the things that you've seen happen in the last few years, I'd like to celebrate or give you the opportunity to celebrate some of those examples of work, because like you said, it is a source of great pride. You're telling me from staff surveys that staff are interested in doing it. They want to see this happen. There is a growing public, call for concerted action on this. And that's exactly what you're trying to do. Join the dots and hit home on making a difference.
Yeah, there has been. We come in with our strategy building on work that has already been done within Capital and Estates in terms of decarbonisation of our buildings. So they've done great work over the last number of years. We need to get to a 50% improvement in energy efficiency by 2030. We're at 34%, which is not bad, but we've a good way to go. But they have a plan. They're working across a large membership of staff to build on that. But what we need to reduce is that by year is the electrical supply of a hospital the size of Limerick, which is quite significant.
So taking that out of the system.
Taking that out of the system if we need to get to that 50%. So that's a big chunk.
So we need to make things greener and conserve that at that level. Right?
Yeah.
Okay,
yeah, exactly.
Retrofitting our buildings in such a way that, we've quite a lot of old buildings, people know that. Buildings that people love, buildings that work for people, but not buildings that sustain or retain energy in any way at all.
Yeah.
So we need to retrofit them so they retain energy. We both have a large number of examples, but the thing about the examples, and when we go into the specifics, is it's extremely heartening to see what people have just got up and done on their own. They haven't, nobody's pushed them, nobody's resourced them, nobody's told them to do anything. They've just gone and done it. And that's what's fantastic about our staff and our workforce, is they're doers. They get up and do stuff. We've partnered with a number of the colleges. The ICGP have developed clear guidance on the use of inhalers in partnership with the Irish Asthma Society. So always involving service users in what we do. Otherwise, it won't work. The College of Surgeons have come up with a clear approach to greening our theatres, trying to reduce all that crazy amount of waste that we develop with every procedure that we carry out. Our College of Anaesthetists are working with us, and they're leading on eliminating some of the more toxic anaesthetic gases and reducing our reliance on the others. And they're making already palpable progress across many, many sites. And one particularly nice example, I was there for the inauguration of, I planted a tree as part of it, so I feel personally I've contributed to it, and not in any major way. But in Piedmont, Tanya King, who's the CEO there, has led a greening of what's quite a green estate anyway, insofar as there's, some of our estates very concrete. It's in the middle of a city. Piedmont is kind of a little bit out, and there's some fields, and they have done an absolutely beautiful job there of creating a biodiverse environment, which the people who use the services absolutely love. The staff love. They've replanted hedgerows. I planted a tree there. A whole lot of positive things have happened there, and it's a way more beautiful place to go to now, and to work in and to receive services in. And it's just solar panels in St. Mary's in the park. The entire roof is now roofed by solar panels. We just need to grasp onto some of these good examples and multiply them up.
Delighted to see that green space is really called out very strongly in the strategy because, and I'm conscious from my experience in, the old Midland Health Board where I kind of started, that there is loads of old sites that you mentioned, but we have sites in every capital town in the country. There's HSE sites, and to look at the potential of those sites. I know that you're talking about retrofitting, but also they have potential to be health enhancing spaces, walking spaces, green space. I think that shift in thinking, that there's not just an addressing here, there's an opportunity. Roisin.
And maybe just to come in with some other examples as well, like some people or some of the listeners might be aware of the Smarter Travel Mark, which is a government initiative, and a lot of our services have actually signed up to that, which is fantastic. It's looking at active transport, looking at cycle infrastructure, looking at paths. So we're doing that across our estate as well, which I think would be brilliant.
So this will help the human resource traffic and the human capital traffic that has to get into our buildings.
Exactly, yeah. And I think obviously Philip talked about waste, but waste is a massive one. And within Capital and Estates, we do a wide training programme offered to all staff. We're encouraging binless offices. We run waste campaigns. We've now started to purchase food waste composters, which is really interesting. And also ICT, that's a huge area, a huge scope for ICT recycling and repurposing. Other quick things to mention, there are some great work happening within procurement in terms of how we procure our food to feed all our patients and staff. So we've looked at more sustainable diets, and we're working with catering managers to try and make sure the menus reflect that. And there's been really good feedback across all our sites, which is fantastic.
No more than we were saying earlier, nobody likes to see waste, do they? You were talking earlier, Philip, that the staff, there's a huge can-do army of people in the HSE, and they want to do. It's can-do people and want to do people. And when you see waste and you think there's a service improvement here that's just about reduction of waste, that helps every angle, isn't it?
And I think that we had some lovely examples actually yesterday from some staff around polytunnels and how food to table. So growing their own vegetables, growing their own fruit, bringing it in, the staff can use it, they can bring it home, which is fantastic. So I would love to see more of that happening.
That was one of the projects for the Excellence Awards. So really good. I'd love to see that.
And it's nice to hear you when you say about waste, reducing waste, because a lot of people think, we just need recycling bins everywhere.
Right.
But, recycling involves a certain amount of production of energy in itself. The key is really not to produce the waste in the first place. Avoid waste, and so greening our theatres, getting rid of single-use cups in all of our canteens and restaurants. You could go on, but there's so much we could do in the area of waste, and we're starting to do it. And we want to support our staff to push for action in their local area and push their managers to really prioritise this.
We have got an internal staff campaign which actually gives people simple actions that they can do in their daily job around those 6 priority areas of focus that we talked about earlier. And we've had great traction and feedback on that. And we hope to build on that with more information for staff. But also, I think really importantly, we want to next year try to bring in our service users and the general public as well, and maybe work with them a little bit more in terms of, both from an educational point of view, but also getting them involved in our projects.
Yeah, I think that'd be great, because one of the things that and I think I experienced it myself, is a bit of climate anxiety about what the hell are we doing here? Where are we going? And you hear these big stats, and you opened at the top of the podcast there, Philip, you were talking about the state of the world globally, which makes me feel a bit powerless. But when you go to the tangible things and you go to your community and you say, talk to your manager about things that you can do in your area or your part of your work, it completely kind of brings it down to the tangible, doesn't it?
I think it's interesting that you mentioned the term anxiety, because when you talk about the health effects of climate change, I think mental health is one of the major areas that has an impact on people, and particularly younger people who, like, I'm not a younger person, although I may think I am. And I think, we have a responsibility to the next generation. That's another reason why we need to act on this, and that's the reason why we are. But I think Roisin referred to the importance of training, because we don't all know what the answers are. And as you say, if we're not armed with some simple kind of actions that we can take and things that we can do that are evidence-based, that will reduce our impact on climate, then anxiety takes over. We don't want people to be anxious. We don't want to create fear. We want just people to be supported and freed to act. So we're providing training in various different modalities, and we're going to hopefully by next year have an online training that'll be available to everybody.
Yeah, I participated in some of your online training and one of your recent webinars. And even the webinar, I thought, gave a certain level of comfort that there's so much coordinated action going on here, that the messaging that coming across really loudly was, we're trying to do this here, we're trying to do that there, that there was different examples being given, and it certainly showed that there's a growing workforce getting behind this.
There is a lot of work underway, and we've made a lot of clear commitments in our strategy. And one of the things we are doing is we're publicising the strategy as we are today, as widely as possible. I mean, we speak about it at different events every week. And that's with the view to people knowing what we've committed to and calling us up if we don't deliver to it. Because this is too important. I don't mind if people say we're not delivering in a certain area, call it out, and we'll work together to try and overcome. If there are obstacles for acting in the way that we know we need to, then let's call it out.
One of the examples that I'd like to ask you a bit more about was your partnership with Uisce Éireann around water. We're given stats. We're talking about the scope of the health service, the buildings, the staff, the scale. You were given the example of the operating theatre and things that have been thrown in a bin after every procedure. But when you think of something as basic as water for the health service, but you've identified water conservation as a key issue.
So within the HSE, obviously we need water for everything that we do within the HSE. Yeah. So it is a challenge when we try to conserve the amount of water that we use. But we have a programme across all our sites in terms of a water metering programme.
Okay.
So most sites now should have access to proper management, so being able to monitor and track improvements. And I suppose within Capital Estates as well, they have a number of different initiatives that they're working on in terms of replacing old taps, old sinks, things like that. So yeah, it is a challenge.
Who employs the energy officers that are working on some of these issues at a local level? Are they employed by the hospitals themselves or the...
So they would be part of the Capital Estates work programme, yeah. So they would report into Capital Estates, but also would link very heavily across the broader aspects of the strategy. So initially they would have come in with a remit to just look at, I suppose, energy related stuff. But as we've grown and as the strategy has come on board, now it's becoming much broader, and energy teams, which was what we started with, are now becoming green teams, which is great. So I think we've around 150 green teams across.
Okay. So they're everywhere.
Yeah, exactly. Well, nearly everywhere.
And in terms of what people can do to support this work, what's the call to action for either staff or members of the public listening to us today?
Yeah, we're not making demands of anybody, but certainly I think we know a lot of people want to do something. So as Roisin's already kind of laid out, we're giving guidance about specific things. But it's in areas like our personal energy use, turning things off. It's extraordinary how often computers can be left on overnight, totally unnecessarily. Looking at waste, not generating it in the first place and then segregating it accurately afterwards. So, for example, hazardous waste, only put hazardous waste in the hazardous waste bag, because that's high energy use, the destruction of hazardous waste. Look at green transport, to explore the options, personal options and options for your friends around, colleagues to get into work in an active travel way on the bike, using public transport. Telemedicine. Let's support telemedicine. patients and service users loved telemedicine when we developed it during the pandemic, and we developed it overnight. And we need to sustain appropriate use of telemedicine. It's not appropriate for every type of consultation, but the fact that a service user could be phoned and they know roughly what time of the day they're going to be phoned, they just have to be in. They don't have to spend the entire day travelling to a hospital and waiting to be seen in a crowded outpatients. We need to promote the use of telemedicine, conserving water. Ask people about what's been procured in your area and have we thought about how sustainable it is. Keep asking your managers what they're doing about it. Push people, and for the general public, if you're engaged with the health service, ask about how sustainable, and analyse yourself how sustainable you think the provision of the health service you're receiving is. Because I think we all need to just push services and the system into a sustainable space. And we're definitely moving in that direction.
Roisin, do you want to come in on that answer?
No, it was just actually, again, I just heard recently of a really nice example of a service that's gone wholly active. So active travel.
Okay.
So all of their staff come to work using either walking or their bike, and all of their service users come either walking and bike, which I thought was fantastic. So I think that's a really good example.
It's a mindset shift, isn't it?
It is a mindset shift, but I wouldn't like people to think we think everybody can cycle to be seen in a hospital or in a clinic. People are unwell, people are, and sometimes the infrastructure is not there. If you can't secure your bike safely, people aren't going to cycle to the institution. So we're very much pushing for safe bike sheds and that kind of thing. Things that make these things easier. There isn't a kind of a template you apply and everybody adheres to it. Yeah. That just leaves too many people out who can't do that. But shifting the dial in that direction, certainly that's the way.
Thank you so much for sharing so many different examples and insights about this work. I'd like to ask you now, in terms of your vision for the next couple of years, where do you want to see this going? I know, Philip, you've given the rallying call there for health service staff and leaders across the system, to try and get them to reflect on what they can do. So, Philip, where do you want to see this going in the next couple of years? Where do you see this chain of work driving to?
Well, certainly I would like to see it continuing to become part of everyday business for everybody, that every decision we make is in some way influenced by our concern about climate change and the impact on the planet and the sustainability of what we do and reducing our contribution to that harm. I'd like to see us really focusing more on prevention. So much of the disease that we treat, and we talk about the demand being, rising every year for our services. One obvious way of reducing the demand for our services is helping people live healthier lives, preventing illness. A huge amount of heart disease and diabetes and cancer is preventable, and so much better for our population if we can help them prevent that. So I'd like to see an increasing focus on prevention generally across our health services. I'd like to see the work of our capital and estates colleagues really being supported with significant funding that's going to be required to really make our buildings energy efficient and carbon neutral ultimately. And then I'd like to see us all working together to radically reduce the amount of waste we produce, because it's at in very, very high levels.
Roisin, what's your hopes for the future?
Yeah, look, I think just to build on, I totally echo what Philip said, but just to build on that, I think it would be great to see more community involvement. So more working collaboratively with our patients and communities on this. There's huge scope and potential there. And I think lastly, education is a huge piece here. I think we owe it to our staff, but also to our service users to really use and educate them on this. And I think one of the key areas where we need to build on is measurement and how we measure our carbon footprint and people's understanding of what carbon footprint is. Yeah. I think that'd be a great place to be in 3 or 5 years' time when people actually understand that.
Okay, great stuff. I'd just like to ask you about your conference there. You mentioned your conference, but I saw the name of your conference there, Ireland's Journey to Sustainable and Resilient Healthcare in a Warming World. So you're really trying to capture both the offer and the warning in the title of the conference.
That's the middle ground you try to travel in. We're not doom mongers, but we do understand the current threats to our planet. And we do understand our contribution to it. We also understand our potential to contribute to a much more sustainable planet, and we intend to pursue that.
Okay, well, look, I'd like to thank you both, Roisin Breen, Dr. Philip Crowley. Thank you very much for coming in to speak to me today. And to all the listeners, thank you for your continued support. And please share this episode with anyone you think would get value out of it. If you'd like more information about HSE Health and Wellbeing, follow us on X or take a look at our Health and Wellbeing YouTube channel, or register for our e-zine by emailing healthandwellbeing.communications@HSE. And I'd like to thank you all for listening to another episode of the HSE Talking Health and Wellbeing podcast.